first 2 degrees in Chinese studies, which
Yeah, I should have mentioned.
explains why I've spent so much time in China in my career. I ended up having a kind of parallel life of being the China wonk on the one hand, doing most of my work and research and consulting in China, and then working in the area of which I have my PhD, which was international health and population, and teaching in that area, which is more global. So I'm really a global health person, and I'm hugely impressed by what Mike has built here over the last 10 years. This place is really a leading institution in global health, and it's been really fun to watch the Duke Kunshan campus get launched with the global health focus led by Kang Xianglan, and it's just been so great to see all these people I've known in my career come together in my own interest area. So I spent 15 of the last 35 years living and working in China on different parts of global health policy. I started my career with UNFPA in the early 80s and then was back for Ford Foundation, as Mike said. And I've worked when I'm not actually living in China, and then most recently for Columbia University. When I'm not actually living in China, I'm usually working on China research and consulting related to global health policy issues, especially reproductive health and HIV/AIDS and other issues that I've focused on over time. So today what I wanted to do was, given my own sort of background in population issues and population program in China and the health issues in China, to try to blend them together into a kind of overview of what the current health and demographic challenges in China are today from my perspective. So a lot of experts in the room, many who have known for a long time, so feel free to just jump right in if you have something to add. So I would say the biggest challenges these days in 2016 going forward have to do with the very rapidly aging population and the health challenges that those present. Not only the health challenges, but the demographic challenges in terms of the skewed age ratio. Chronic diseases, China's moved very rapidly because of the wonderful health advances the country has made in the last 50 years, 60 years. China's moved from a place no longer characterized by a predominantly infectious disease profile with reproductive morbidity and high infant mortality to a chronic disease profile. And this is really a huge challenge for China as per capita income has gone up. We have the diseases of a wealthier society, including diabetes, obesity, and certainly the problems of smoking-related diseases. Then, of course, China is the epicenter in many ways of emerging and drug-resistant infectious diseases, and this presents a very large challenge for China's health system and for the world, in fact. And then, of course, we are all very familiar with the really bad problem of urban and environmental health. The air pollution makes headlines on a regular basis, but China is also dealing with a very large problem of water and soil pollution, all of which affect food safety. In addition to the water pollution issue is the issue of water scarcity, and water, of course, has a major role in public health. And then finally, China has a large adolescent population, and so the challenges of adolescents in this very rapidly changing society also present another set of challenges. Let's just start with the contextual factors. On the demographic side, you've had China's one-child policy for the last 35 years, and I must say I was around when it was launched in 1980, and whoever thought it was going to, 79 actually, who thought it was going to last for 35 years. It was supposed to be a policy for one generation. But this 35-year policy has really resulted in a very substantial age and sex distortion of the total population. There's a growing aging population with this very high life expectancy, as I said, a result of the low fertility over many decades, which reduced maternal mortality, of course, and the success in reducing infant, child, and maternal mortality, as well as infectious diseases. So you've got a lot of people surviving. And then you have, urbanization, which is another large demographic trend. You have 50% of China's population is urban now, but the plan is to have it be 70% by the year 2050, which will present a large set of challenges for urban health. So on the health side, you have, as I said, you have this major shift of chronic diseases to the non-communicable diseases, and I'll go more into this. But with that, you have very poor behavioral prevention related to the risk factors for the NCDs, for the non-communicable diseases. You have very poor early screening and early intervention on drugs. So when you have people get sick, or they're sick with these chronic diseases, they're in much more serious stages of disease by the time they get into the health system, which costs more and obviously results in poor health outcomes. And while on the one hand you've had a huge change and wonderful development in health insurance in China since 2008, the government basically got the wake-up call after the SARS epidemic and the poor state of China's healthcare system, rural healthcare system, the lack of financing, and all the problems that came from the low coverage of health insurance, and revitalized a nationwide health insurance system. Now you have about 92% coverage, maybe even higher, but it's resulting in high use of the healthcare system, especially the hospital system. And actually the costs are really going to surge due to the kind of intersection of the aging population with the poorly prevented NCD burden. So, it's going to potentially break the system in terms of cost going forward. And then, of course, you have risks from poor food safety and partly caused by environmental pollution, but not fully caused by environmental pollution. So I'll go into all of this more. So just looking at the larger policy context, it's not as if these things are not on the screen. They are, but of course the urbanization policy, that's been pushed. That was pushed in 2013 by the Prime Minister of China, Li Keqiang, as a way to really increase consumer spending and consumption and shift the Chinese economic model. You had the new health reform program, insurance program, which was launched in 2008, which was a major overhaul of the health system. And then a large part of the policy context has been the merger of the Health and Family Planning Ministries in 2013, and just this year in March, the really kind of formal end of the one-child policy. Everybody allowed to have 2 children going forward, but still it's just 2 children. It's not everybody can have as many children as they want. But really too little too late in a way. A food safety law that was issued in 2009 that followed many serious food scandals in China, which I'll talk more about, and the Food and Drug Administration, which was established in 2013. And then more recently, stronger environmental pollution regulations issued in September 2013, and really strengthening emissions controls and putting more power to the State Council and 6 key ministries to coordinate emissions controls, but of course the problems in the implementation. So let's just do a kind of a quick overview of the population. China's got the biggest population in the world, but India, the population is currently 1.358 billion, but India is going to surpass China. I have in 2022, but it may even be sooner than that if I think I've seen some of the more recent estimates. There's still an annual increase of 12 million people a year, but it's really down from a peak of of 23 million a year in the 1980s, and the population really is at below replacement fertility. But because of population momentum, the population will continue to grow for another 15 to 20 years and peak. So even while you have, the end of the one-child policy, the population will still continue to grow. And I think this below replacement fertility is going to be extremely hard to reverse. 35 years of the one-child policy, families just don't want many kids. They're too expensive. The norm has changed. And I don't think you'll see any kind of major upsurge in birth, maybe on a short-term basis. But the population is going to continue to shrink. And the policy is really ending, not so much because of total numbers, but because of the really disproportionate and skewed age ratio, especially for the aging population. China has almost 200 million people, 14% of the population now that's over 60. I mean, that's a huge number of people. It's really a large, it's bigger than the population of Japan, right? By a long shot. But by 2030, that population is going to be 400 million and 24% of the population. That's a lot of old people, and in a country that doesn't have a very well-established social security system. Because of that, and I'll just jump to my fourth bullet point under this, is the skewing of the population has resulted in a really decline in the new labor force entrance population. So even in 2012, which was the first year you started to see new labor force entrants decline, it dropped off by almost 3.5 million people. And it creates this very high dependency ratio of the aging population to the workers who were generating the money for the social security system and the pension system. So that's only going to continue to worsen as the aging population increases and the labor force size decreases. Also, the other really major impact of 35 years of the one-child policy has been the skewed age, sex ratio at birth. Currently, there are about 33 less women than men, and China has a very, very distorted age ratio because of son preference. So if people only have a chance at having one child or two children, there's been increasing use over the last 20 years, especially of sex-selective abortion, to ensure that that child is a boy. So you've got a very skewed number of men to women in the country, which is probably going to have some impact on the marriage prospects for poor men in the years to come. What does all of this say? This says that China's demographic dividend really has ended, and there's been recently a decline in China's economic growth, which has to do with the global economy, but partly it's due to the drop-off in new labor force entrants. And I don't think the demographic dimensions of this will help in the period to come. So let me just get into some of the health issues now. I'm looking at the non-communicable diseases. According to a World Bank study just of a few years ago, NCDs are really China's #1 health threat, and they're really 80% of the 10 million annual deaths and almost 70% of the total disease burden. The main NCDs are, cardiovascular diseases, chronic obstructive pulmonary diseases, partly due to smoking and to air pollution, diabetes, 10% of adults over 20 years old, and child obesity, which is a huge growing problem in China. China's #2 globally for obesity, and it's 14% of urban boys 17 to 18 years old are classified as obese these days. Lung cancer, a major problem. There are 300 million smokers in China, and 50% of men in China smoke. But I must say that just in this last year, there's been a real upswing in government's willingness to engage in anti-smoking campaigns and sign on to the global convention and really start to ban advertising and smoking indoors. So I think we're seeing the beginning of more government action on an extremely serious problem in China, and one which is going to contribute a lot of mortality to China in the years to come. So, just to say that China's the aging population is going to increase the NCD burden by at least 40% by 2013, and it's already at a pretty high level. But the primary healthcare system is really poorly equipped to deal with the prevention and the treatment of NCDs. There's very little going on in lifestyle prevention programs. I think in the urban areas where you have a more educated population, exercise and diet issues are becoming kind of better understood. But for most of China's population, being able to purchase meat, especially fatty meat, cigarettes, and enjoy a more middle class or upper middle class lifestyle is still a relatively new thing. And the lifestyle prevention programs are certainly not in place, and individual behaviors are certainly not in line with the disease burden problem of the NCDs. So this is a real challenge for China's health system, how to push forward the kind of health prevention work of a more developed country in a place where wealth is relatively new and the lifestyle is still relatively new. So as I said earlier, the hospitals and health insurance systems are going to be really burdened with the NCD morbidity and mortality as the NCDs and the aging population continue to intersect. So let me talk about urbanization and urban health for a second. So in around 2013, this major government plan was instituted to spend $6.5 trillion on urbanization in China and build a new middle-class consumer society to spur the next phase of GDP growth. And this is really the idea of transferring, income generation from the poor manufacturing sector to more of a consumer society in China that would be much more domestically driven, an export manufacturing society to an internally driven consumer society. And in 1980, you had 20%, when I started working in China, it was 20% urban, 80% rural. And you had about 200 million urban residents with very, very strict restrictions on movement of the rural population to the urban population through the household registration system. In 2013, now the household registration system was relaxed during the economic liberalization period of the 80s, 90s, and 2000s. And with millions and millions of rural migrants moving to the cities for work. Now in 2013, you have 53% of the population who are urban, but only 35% of them actually have the urban household registration. So you have 670 million people living in the urban areas, which is an increase of 480 million in 30 years. Now, when you talk about China and numbers, you're always talking about these huge numbers. It's kind of hard to conceptualize. It's bigger than the population of the United States, right? And that's just in the urban areas. And by 2025, the country's projected to be 70% urban, which would be an additional 250 million urban residents. And just looking at Shanghai, which is China's largest city, it grew from 16 million in 2000 to 23 million in 2010. And it's just a lot of people in the urban area. Having just moved back from Beijing at the end of January, you feel the urban density on a daily basis. Everything's crowded. The subways are crowded, lines for everything. It's just crowded. There are a lot of people. And all these people in the urban areas make it very, a challenge for many, many parts of the social service agenda.
Can I ask a clarification question? Sorry
yes,
to interrupt you. No, I just wanted to know whether you have a sense of how much of that urbanization is due to people moving from rural to urban areas, or a reclassification of rural into urban areas, because sort of a segment of that. So meaning that has implication for lifestyles, right? Rather than having people move, you just reclassify them as urban. right? And so that's kind of something
You know,
that.
the reclassification is definitely part of it, but with the reclassification is these sort of absorbing up of these rural villages around the urban areas, expanding the urban footprint, and moving the rural population into the urban areas and out of communities, which has, you know, it's had a very significant impact on you know, people's employment prospects in the city, the loss of urban land and of community. So there's many things going on that are part of this massive urbanization push. And in fact, I would refer you to a fantastic series of articles by Ian Johnson in the New York Review of Books and New York Times, who really has documented the kind of human toll of the urbanization policy in China. Very moving. Anyway, but just to say a little bit about the big cities, you know, you have 153 cities with a population over 1 million, and that's going to grow to 226 by 2030. And then 14 cities with a population of 5 million, which is going to grow to 32, you know, which will be 40% of the global total. And then these 3 huge mega cities, Beijing, Shanghai, and Tianjin, which are just enormous with populations of over 10 million, and maybe 8 of them by 2025. And I say populations of over 10 million. Beijing is like 23 million, right? These are huge mega cities, really big metropolises. So there are a lot of challenges. You know, the air quality, obviously we all read about it all the time, is a major challenge. And traffic, walkability, community cohesion, the loss of urban, you know, urban neighborhoods as these big skyscrapers are being built and the traditional areas are, you know, are taken over, the urban neighborhoods, something my daughter's working on right now in Beijing. Water availability, a huge challenge in the north. There's been this massive south to north water project to bring drinking water to Beijing and Tianjin. And there's really water scarcity in China. That's a continuing challenge. Food safety issues, how do you ensure the food safety for such a large urban population? Inequity in health service access for the migrants versus the urban residents who are, the migrants who are not included in the household registration system and who's have health insurance, but it's only usable in their home village, so it's not portable. So that's a major challenge in an area that's under much discussion with some experimentation these days in China. So you've got also this challenge of emerging and drug-resistant infectious diseases. You know, I'll talk about the emerging infections in a second, but you've got a really massive problem in China right now of antibiotic resistance. It's one of the major epicenters of antibiotic resistance. The overuse of antibiotics, both in livestock, along with all the water and soil contamination that comes from, you know, from livestock grazing, and the overprescribing of antibiotics in humans for a very, very long time in China by the lowest levels of the health system has really created a very big problem of antibiotic resistance in China that is spreading. And I was recently at a WHO event on antimicrobial resistance in Beijing, where one of the speakers said that the hospital-acquired infections that in many hospitals, over 50% of them are resistant to standard antibiotics, which is a really scary thing. I said, well, why don't you just ban the use of antibiotics in the livestock industry? But those sectors are so absolutely separated in China, it's very difficult to do that. But then you also have the problem of multi-drug resistant tuberculosis. And of course, we have the tuberculosis expert in the room here, so anything I say, feel free to correct me, Sean. But you know, China's got the 3rd largest TB epidemic in the world after Central Asia and India. It has 50% of the global burden of tuberculosis, but it has 33% of the global burden of multi-drug resistant TB. And even while there's been a massive improvement in the last 5 years through the expansion of testing, there continue to be problems with the drug regimens and other issues to really control the, really control the epidemic. So that's a big challenge, and one that China is really grappling with, and many international donors are trying to assist with, given the potential to spread well beyond China's borders, as it already has. And then looking at emerging infectious diseases, China has really been one of the major incubators for avian and swine flus and other emerging infectious diseases like SARS. You've got very densely populated southern and eastern China and very close proximity of people and animals. There's a lot of backyard animal husbandry in China, a huge poultry industry, 14 million fowl, and 70 to 80% of which are backyard flocks, and much intermingling of wild fowl, on migratory pathways with the backyard flocks, which has been responsible for transferring things like avian flu around the world. Of course, the live animal markets, to some degrees, were closed down after the SARS epidemic, but have, they're back in full force, especially in southern China. And a place which has been the origin of SARS, swine flu, the avian flus, the origin of the H7N9 and the H5N1, these highly infectious flu strains that have spread over the last few years. So this is, no question that this will continue. This is not something that's under control. The question there is really about early identification and containment, and I think the SARS lesson for China really has helped to move forward a system where the government is much more accountable and responsible for surveillance and early intervention. But it's very challenging given the, the economic incentives in the poultry and livestock industry. Farmers and breeders, they don't want to report deaths because they don't want to have their flocks, wiped out cold because of the economic losses. So it's been hard to coordinate the veterinary and the health authorities, especially at the local levels, to do what's really needed to keep it under control. I would guess it's the One Health thing that I saw referred to in your report from the Clinton Center. But the surveillance has really improved a lot since SARS. There's very close collaboration with the World Health Organization and the US CDC. They have set up computerized disease reporting. 93% of the counties and 43% of the township hospitals have a direct link to a computerized real-time reporting system set up by the CDC, the China Centers for Disease Control. And all the counties have a direct connection to the Ministry of Agriculture monitoring system. So they're getting there, and they have this real-time internet-based reporting, which I think has been, really evolved, from the sort of the slow county-based monthly reports all the way through 1985 to these electronically submitted monthly reports to now this real-time reporting from the township level, which is a level below the county, and really has helped for early identification. Let me talk a minute about air pollution, something I've lived with much too long in my life, and I hope my lungs will recover enough to, from all that exposure. But since, I think when I was living in China in the 1990s, I had no idea that smog was as bad for me as it is. But starting in around 2011, the Chinese government started reporting the air quality index in real time, mostly spurred by the fact that the U.S. Embassy in China was reporting, set up monitoring stations, certainly in Beijing and other major cities, and was making that information available, and the Chinese public was more and more clamoring to understand just how bad the air was. But shortly after I arrived in 2012, in January 2013, people called it the airpocalypse, right? There was this horrible air pollution incident in Beijing where the air quality index reached 886. Now, the healthy level is 25 and below is set by the CDC. So 886 is pretty bad. That's PM 2.5. That's, 35 times the WHO standard and 5 times the amount in an airport smoking lounge. And that lasted for about 4 or 5 days. It was pretty disgusting and nobody went out. Or those who went out were sorry they did. And, people really started to wear masks after that, I would say. But the health, it set off a real sort of tsunami of research on the air quality in China as well, and much more citizen interest in this. There were, I think following that, there were 90,000, well, not following it, but 90,000 mass incidents in China related to protests about air quality. And in proceedings of the National Academy of Sciences study just a few years ago, calculated that 1.2 million premature deaths in China. I said 1.2 premature deaths, but I meant 1.2 million premature deaths in 2010, which is 40% of the global total, due to air pollution, and that there was a 5.5% reduction in life expectancy for people living in northern China. And there's something very significant. This last year, about a year ago, a Chinese journalist made a kind of YouTube-type video called Under the Dome, which went viral in China, where she really talked about her own pregnancy and giving birth to a child with health problems as a result of the air pollution in Beijing. And this really it's so much part of the public outcry these days that the government has become much more accountable about it, and it's a major there's a major effort underway to clean up the air, but it's going to take a long time to do that. And this is just the same scene in Beijing on a really polluted day and a really clear day. So it's pretty amazing, right? That's what you live with when you live there often. But less well known is the water and soil pollution. There's a lot of toxic runoff from industry, heavy metals in the soil and water, chromium, lead, mercury, and arsenic in particular. And according to the Chinese government itself, about 60% of the groundwater is polluted. There's also toxic topsoil from air pollution and from precipitation, and a lot of unsafe pesticide residues from farming in the waters. So you have these routine algae blooms and clusters of cancer villages near the most heavily polluted lakes and rivers. But in addition, you also have water scarcity, freshwater deficits, rivers drying up in the north, and really overuse of water for irrigation, which is exacerbating the problem. 60% of the fresh water use goes to irrigation in China, and they do these massive engineering projects to move water from the south to the north to deal with the needs of the big cities. And then just, the food safety issues have really also gotten on the screen in the same way that the air pollution issues have. China has had this massive economic growth over the last 30 years, but with much less regulatory oversight than really is necessary, but difficult to do because so much of the producers are family producers. They're not these big agricultural farms. It's very hard to regulate. It's really an honor system, which hasn't been working. So you have, plus you have all these farmers being moved to the cities and their agricultural land converted to industrial use very close to the cities. So the runoff gets into the farm fields that border these industrial areas and has contributed to a lot of the water and soil pollution, and to the chromium in the food, for example, and other types of heavy metals in the food. the food safety issues fall into a number of sort of environmentally caused ones, like the overuse of pesticides and the toxic industrial waste, the overuse of antibiotics and hormones in the food, in the livestock industry. But you also have this horrible thing of the illegal food additives, to make these products more marketable. And you've had a number of these different scandals over the last 5 to 10 years, like the adding red dye to watermelons. That was in 2006. The melamine in milk powder and baby formula. That was the big scandal in 2008. You had, something like some large number, I think 34 children died and 300,000 kids were sickened from this. You had this ractopamine, which was added to make pork appear less fatty. It was a poisonous chemical. And then the gutter oil scandal, the collected oil from the gutters that was then reprocessed and used for cooking and largely for street food. So you had these horrible, food scandals that, get into the press. And just most recently, a woman in Shanxi and her daughter selling these expired vaccines all over the country to pretty much 24 provinces, So these, there's not enough honesty within the system. People trying to make a buck and not enough regulation. The honor system isn't working, and there isn't enough capacity for safety inspections. But the whole infrastructure has been strengthened. It's still not sufficient to meet the need, and there's really a strong need to have training in good manufacturing practice standards and the kind of voluntary compliance stuff. But this remains and continues to be a big area of public concern. So finally, I'm just going to talk about the last challenge, and this is an area where I've done a lot of my own work. We'll be continuing to do some work, is on adolescent health. China has a huge number of young people, the second largest adolescent group worldwide. And it's 24% of the population, and 33 million of them are economic migrants to cities who are out of school. So this represents a large number of people, a large number of youth at risk. And if you look at what's going on in this adolescent population, it's still, the adolescents are still largely governed by a fairly traditional society with morality about sharing sexual information with young people, poor sex education in the schools, lack of access to services for reproductive health. But nevertheless, because they're very globalized, like all other kids in the world these days, with access to the internet, television, movies, and everything else, you have an increasing number of sexually active kids. In a study, a very important study that was done by Beijing University a few years ago, nationwide study of I think it was something like 200,000 kids in 24 provinces. You really found that of these sexually active youth, a quarter of them had become pregnant, and of those, not surprisingly, 86% ended in abortion, which is not at all hard to obtain in China. Of those, you found that at least half of them had, 6% of them had repeat abortions, and 50% of all the abortions in China are among unmarried youth. So there's really this sort of epidemic of abortion among unmarried youth, which is just not really being adequately dealt with through the social service network. These kids, like kids everywhere in the world, look for anonymity and privacy, so they go to these private hospitals, which advertise widely on buses and other places, and there's no HIV or STD risk counseling, there's no provision of contraceptive counseling, and it's basically a 5-minute in and out kind of thing, and they go back out and they get pregnant again and have another abortion. So it's really an area of tremendous need in China for the government to kind of get organized and start addressing a very, very real problem, which isn't, not only about, repeat abortions, it's about the possibility of risk of STDs and HIV and other issues if they're having unprotected sex. So just to cite a couple of studies, in Beijing, you can see that, in the bigger cities, they have multiple sexual partners, and very few of these youth use any contraception. The abortion rate is high, and the abortion rate was, 42% for unmarried kids. And in the study that we did I was doing in Kunming, together with a close colleague at Kunming Medical College, with a small grant from the Ford Foundation, we looked at 2 public and 1 private hospital that were providing abortions. We found that half the abortion seekers were unmarried, and of those, 80% were adolescents. Some of them as young as 14, 15 years old. Over a third of them had not even used any contraceptive method at all, and were mainly unaware about the options. Nobody had really talked to them or provided them with any locally. For the abortions themselves, there was absolutely no privacy. The consultation room was full of other waiting patients. There was not even an opportunity for the kid to ask any questions. Of course, these are young people. They were uncomfortable. It was very, very difficult to be, they just wanted to be out of there as quickly as possible. What these kids did was get their information from websites, TV programs, and VCDs. So, there's just a huge need to deal with this and put some programs in place. And I'm going to be spending a few weeks in April working with UNICEF on an adolescent health strategy, which hopefully will be able to, get to a higher level of implementation and start the work of dealing with this unmet need. So I think I'll stop there, and I think I have some time to take questions, right? Those are